All right, we're live. I don't think we are getting your audio. I don't think we are getting your audio. Everybody just bear with us for a quick second.
No, I don't intend. Hello, everyone, and thank you for joining me today as I share the findings of my research, the perceptions of project success in healthcare delivery projects, the stakeholder effect. My name is Eamon Kelly, and I'm a scholar practitioner in the project management domain. I recently accepted the post of Professor in Project Management at the University of Limerick in Ireland. And prior to this, I've worked extensively in healthcare, government, and private enterprise, responsible for delivering projects. Now, I don't intend to bore you too much with the research specifics and the strategy that I undertook, but I'm more than happy to share my research methodology and data with you separately. My contact details will be on the last slide. So the session today really will focus on the context and the background of the problem that we're experiencing, not only in healthcare, but across several industries. We'll look at the research purpose, why I thought it was important then to define project success. We'll also review the research participant profile, the people who are actually involved in answering the questions and inevitably giving us the findings that I will walk through today. And then I'll finish off with some key recommendations. So let's set the scene. I think we can all recognize that our project delivery suffers and that within healthcare we continue to experience high rates of failure. We're either over budget, behind schedule, neglecting key user requirements, quality or scope creep. It may be that we've no benefits realized, or as suggested, 20% of organizations fail to meet their strategic objectives due to poor implementation. After substantial time and effort from multiple stakeholders is invested in developing and designing the right strategy, only to see it unravel during the execution phase. Current research actually informs us that 35% of all hours expended in organizations relate to projects. And what is concerning is that $1 million is wasted every 20 seconds within projects. For all intents and purposes, we can't see the forest for the trees. There's nothing new in what I'm saying. I'm sure we've all read and digested countless reports about how to improve our success and delivery of a project. We've all been there, we've done it, and we've actually got the t-shirt to prove it. We've created an executive position for project delivery. We've changed our projects to managing smaller projects. We're ensuring that we have a solid business case before we commence the project. We've even went to the extent of making sure that the people who are responsible or project managers have a professional project management capability. We've limited the number of significant initiatives taken during any given period. And we involve actively leadership from the very top of the organization. And we have a sponsor who is typically active and contributing as a participant to the project, maybe in the form of a governance or as a figurehead. But as the graphic shows, in 2020, between 65% and 70% of our projects either failed or were challenged. And challenged meaning that a key measurement such as budget cost or scope, etc., was not achieved. So we had an overspend, it took us longer, or the quality of the deliverable wasn't what was anticipated. I think it was Einstein who put it best in his definition for insanity. And it's doing the same thing over and over again and expecting different results. So looking at the common denominators, you can see the negative connotations with failed or challenged projects. They lack substance. There's no stakeholder involvement, there's no user, there's no executive. And conversely, then you can see that success is brought about by involving stakeholders in the design, the delivery, and governance of the project. Good stakeholder management implies stakeholder consultation, and in the case of project management, the delineation of perceptions of project success. If members of an internal stakeholder group assigned to a project have differing opinions or views, which are likely to be silent, in terms of delivering a project on time, within budget, and to scope, it is evident that the project will challenge everyone to deliver it successfully. The project stakeholder group that we see here is, if you define it, it's part of the organization or individuals who are interested in or affected by the proposed outcomes of a project. So why aren't they involved? So this led me to the research purpose. So the general problem addressed in the study is that projects continue to experience a high rate of failure, especially in healthcare. And then the specific problem was that you have a management dilemma facing organizational leaders regarding the lack of understanding, awareness, or appreciation of different perceptions of project success criteria held by different groups. So we're looking at assessing the differences in perceptions of project success criteria. Our focus group was that of clinicians and senior hospital management. So there's a comparison between both of those groups. So the project success factors are really about elements of a project that you need to have set up before the project can commence. So ideally, you want to have effective governance. You're going to use a methodology that people within the organization are familiar with, has proven to work in the past. You're looking at utilizing resources that are experienced and knowledgeable in the area of project management. And critically, you've secured funding. You've got over that feasibility element of it. You know about communications and stakeholder involvement. So these are the elements that really kick off your project. But the success criteria really takes it from the past tense. You're looking to make sure that the client was satisfied, that you've improved capability, that the benefits that you'd identified at the outset have actually been realized. And an instance here could be, that you've improved patient care in some way or another. You've met the objectives of time and budget, or you've adopted some kind of new medical technology. So the argument is then, if you're focusing on the project success criteria at the end of a project, why is it that they are not the focus of your attention at the start of the project? So the project success criteria becomes a critical element in ensuring that we can deliver our project successfully going forward. So what the study really focused on was the difference in perceptions of the project success criteria that we just identified, held by discrete stakeholder groups within healthcare projects, such as clinicians on one side of the fence and senior hospital management on the other side. And the elements that we wanted to look at was with regards to project efficiency, organizational benefits, project impact, the future potential, and stakeholder satisfaction. So where were the differences in each of these elements with regards to the individual stakeholder? So the population consisted of clinicians within hospitals and general management. So we were looking at quite a sizable population. And what we find from our participant profile, in hospital management, we had the project manager and support managers. We had the coordinators and we had the team members who are involved in the projects at an administrative level. From the clinician side, what we seen was there was no project manager. Typically they were there to support the project manager. But that from an administrative, clinical, and technical perspective, you had team members who were involved. You also had a project coordinator, or you had members who were part of the clinical unit who were impacted or affected by the outcome of the particular project deliverables. The types of projects varied. We've seen responses relating to the patient electronic healthcare systems, anything to do with digital health and telemedicine, maybe even the harmonization of clinical practice, which is something that we're very focused at here at the moment. Efficiency in financial improvement, hospital information systems. There was elements of it that were involved with facility construction and renovation, and the typical lean processes associated with quality improvement. The average duration of the project, then, we found that 80% of the projects were within that 12-month window, supporting the contention of smaller projects over smaller durations. And then the 20% then we've seen were projects that were greater than 24 months, but less than 48. So these were the constructs that we looked at, that we asked our participants to inform us about. So in project efficiency, typically associated with the triple constraints, the time, the budget, the scope, the quality, whether it was achieved cost effectively, so on and so on. From a study perspective, I believe that introducing the constructs of organizational and benefits was important, because inevitably our way of working to achieve strategic initiatives set forth by an organization, the elements of change, is done through projects. So we need to be learning from them. So it's increasing our capability, our new knowledge, to use it in the betterment of project deliverables in the future. Project impact then, as a construct, was looking to make sure that or engage with participants from the aspect of, were the end users satisfied? By doing this particular type of project, did it enhance the reputation of the department or the people who are actually involved in it? And where was the project achieved the purpose that it set out to do in the first place? Another critical element or construct within the study looked at future potential. The whole idea of improving organizational capability. So, when we fail at something, we learn about it, we make sure we don't repeat it again. In organizations, we need to make sure that that's actually happening within projects, that, there are areas within projects that we're not failing constantly. We're people who are actually working on projects, motivated to work on future projects, because in healthcare, the people who are working on projects, I suppose wear two different types of suits. One is a clinician and, where they're dealing with patients directly. Another one is, this whole idea of, working within teams to deliver project initiatives. And then the typical one that we always see when we look at project success, or why projects fail or why projects succeed, is this whole idea of stakeholder satisfaction. If the stakeholder isn't satisfied, then something's amiss within the project. So we looked at sponsor satisfaction. If it was a steering group or a steering committee, whoever had overall oversight and governance of the project, were they satisfied? Did it meet the client's requirements? Well, the client could have been the organization or it could have been the patient. And then did it meet organizational objectives as it relates to the strategic intent of the organization? So of those 5 constructs that we investigated in the study, we found that in 3 of them there was no difference in the perceptions held by clinicians or senior hospital management. But when we delved down deeper, we found some interesting facts with regards to future potential and stakeholder satisfaction. In the future potential, we've seen that clinicians perceive this construct as far more important than senior hospital management. Clinicians prefer to contribute to project work and build their competencies that maximised the impact of their hospital. Project work, I would assume, offered clinicians the opportunities to temporarily step away from their daily responsibilities and participate in activities that are likely to benefit patients, the hospital, and their colleagues. There is no doubt that clinician involvement in projects enhance the quality of the project deliverables, providing the impetus for elaborate and innovative clinical solutions. In stakeholder satisfaction, that whole construct where we see that research in the past has suggested that project failure is often the result of not meeting stakeholder expectations, and because perceptions of individual stakeholders are often treated in isolation from one another. And for a sector that is relatively newcomer to the whole discipline of project management, it is evident that healthcare professionals have embraced a shared vision of project success. Results confirmed that clinicians and senior hospital management differed in 2 of the 5 categories relating to project success criteria, the whole area of project efficiency and project impact. And from a project efficiency perspective, such disparity, especially in areas that cover time, cost, budget, and scope, that it inevitably impair project performance. The results identified certain project success criteria where stakeholder perceptions were contradictory. This finding demonstrates discrete stakeholder groups do not perceive success criteria in the same way. Additionally, results suggested that senior hospital management perceived project efficiency as more important to project success than clinicians do. And clinicians are more likely concerned with the final deliverable than they are on the constraints of time, cost, and scope. In this study, clinicians typically took on the role of a team member rather than the person responsible for controlling and monitoring the time, cost, and scope of the project manager. So as we can see, each stakeholder prioritizes project success criteria differently. Additionally, results showed clinicians perceived project impact as more important than management. This construct corresponds to the effectiveness of the project, with a particular emphasis on the patient in a healthcare context. Patients inevitably are the beneficiaries of project outcomes, such as reduced waiting times, less invasive procedures, or prompt scheduling of outpatient appointments. Project impact typically relates to long-term measures of success that critically evaluate whether the purpose of the project was actually achieved and strengthens the reputation of the organization. So I want to finish off now with 4 recommendations that can be applied from any perspective, be it from a senior management perspective or that of a clinician, anyone who works within the project team. Because I believe that all stakeholders should have a common set of priorities, or the course to succeed will be fraught with conjecture and risk. As a result, project managers can more effectively guide their projects to a successful completion, especially when you have that shared vision. Recognizing project success criteria of different stakeholders will ensure future healthcare projects achieve a higher rate of success. Project stakeholders must have a shared vision of what the project success entails. Otherwise, decision-making capabilities of the project sponsor and the executive management will be impaired. Identify common project success constructs between disparate stakeholder groups and constructs which, if opinions diverge, facilitate closer communication between various stakeholders in the project team. You need to prioritize, so all stakeholders should have a common set of priorities. Recognize and assess where differences of opinion exist within the project stakeholder groups, and this should encourage inquiry, any resolution of differences, and the beneficial outcomes of all of those involved. It's important to bear in mind that stakeholder perceptions are subjective and are likely to change over the life cycle of the project. Therefore, regular consultation with project stakeholders is critical for the project to succeed. A project will fail if the criteria to assess its success is not continuously defined, understood, communicated, and accepted by all stakeholders. I want to thank you for your time. Finally, can I give a big shout out and thank you to all our healthcare heroes. You're doing a fabulous job.